welcome to East Park Beauty Studio. My name is Lita Darajo and I'll be guiding you through a step-by-step on some of the treatments we provide here. In this guide we'll be looking at UK callus peel and where it originated from. What are calluses and what's the difference between a callus and a corn? What to expect before, during and after your treatment, and then I'll be closing with some of the more regularly asked questions. Now, Beauty Select have been selling callus peel for the removal of calluses to clinics and salons in the UK since 2006, and it's registered as a medical device in the UK. Up until now, callus peel has been manufactured in South Korea and then shipped over to the UK. The callus peel is applied to the problem areas of the feet by a skin softening patch where calluses develop. This patch has all the ingredients necessary to remove the calluses from the feet. So this is a 15-minute, 4-step system which gives immediate results, even after the first treatment. So from the client arriving up to leaving, the whole treatment will take no longer than 30 minutes in total. UK callus peel, which we offer here at the studio, was launched in February 2017. So with the original product having been sold successfully for over 10 years, Beauty Select wanted to look at introducing their very own product, which would not only be manufactured here in the UK, but would also be made up from as many natural ingredients as possible, while still maintaining the results that callus peel had been achieving over the many years. So after several years of development and perseverance, they finally produced their very own UK callus peel range of products, which also has a simple 4-step, quick and easy callus removal system, but it has over 99% natural ingredients in their main callus remover. So the difference from this to most other callus treatments is that it is suitable for diabetics. What are calluses? Corns and calluses are thick, hardened layers of skin that develop when your skin tries to protect itself against friction and pressure. They most often develop on the feet and toes or hands and fingers. Corns and calluses, when left, can become unsightly and painful. But for most people, simply eliminating the source of friction or pressure helps the corns and calluses to disappear. So if you have diabetes or another condition that causes poor blood flow to your feet, you're at greater risk of complications from corns and calluses. What are the symptoms? Well, you may have a corn or a callus if you notice a thick, rough area of skin, a hardened raised bump, tenderness or pain under your skin, flaky, dry or waxy skin. Corns and calluses are not the same thing. So corns are smaller than calluses and have a hard centre surrounded by inflamed skin. Corns tend to develop on parts of your feet that don't bear weight, such as the tops and sides of your toes and even in between your toes. But they can also be found in weight-bearing areas, and corns can be painful when pressed. Calluses, however, are rarely painful. And they usually develop on the soles of your feet, especially under the heels or balls, on your palms or on your knees, and they will vary in size and shape as they form. Now, if a corn or callus becomes very painful or inflamed, see your doctor. If you have diabetes or poor blood flow, call your doctor before self-treating a corn or callus, because even a minor injury to your foot can lead to an infected open sore. So what are the causes? Well, as mentioned earlier, pressure and friction from repetitive action causes corns and calluses to develop and grow. So some sources of this pressure and friction include wearing ill-fitting shoes. Tight shoes and high heels can compress areas of your feet. When footwear is too loose, your foot may repeatedly slide and rub against the shoe. Now your foot may also rub against a seam or a stitch inside the shoe. Skipping socks. Wearing shoes and sandals without socks can cause friction on your feet. Socks that don't fit properly also can become a problem. The repetitive playing of instruments or using hand tools, calluses on your hands may result from the repetitive pressure of playing instruments, constant hand tool use, or even writing. So what are the risk factors that may increase your chance of producing them? Now, a bunion is an abnormal bony bump that forms on the joint in the base of your big toe. A hammer toe is a deformity in which your toe curls like a claw. Other foot deformities and certain conditions such as a bone spur can cause constant rubbing inside your shoe. Not protecting your hands whilst using hand tools, so without wearing gloves, exposes your skin to excessive friction. Now these approaches may help to prevent corns and calluses. So for instance, wear shoes that give your toes plenty of room. So if you can't wiggle your toes, your shoes are too tight. Have a shoe shop stretch your shoes at any point that rubs or pinches. Use protective coverings, so wear felt pads, non-medicated corn pads or bandages over areas that rub against your footwear. You can also try toe separators or some lamb's wool between your toes. Wear padded gloves when using hand tools, or try padding your tool handles with cloth, tape or covers. So what can I expect to happen on arrival of my appointment? Well, firstly we'll go through your consultation form together, both to check that you are suitable for treatment and to verify that the area to be treated is calloused and outruling any other conditions that may be present. Once you are laying comfortably on the couch, the therapist will start by dispensing the callus remover into their gloved hand and apply to the area of the foot to be treated. They will then proceed to wrap the treated area in cling film, and this will be left on for 15 minutes. Now, during stage 2, the cling film will be removed. Then using the foot file or scraper, the therapist will gently scrape away the loosened callus or serum residue from the area until it is all removed, and then repeat on the other foot. Now, the third step is where the area will be gently buffed, removing as much of the callus as possible, depending on the growth and severity, but in most cases all of the callus is removed. Then in the fourth and final stage, the gorgeous eucalyptus citridola leaf oil aftercare cream is massaged into your feet, and once absorbed, you are then all set to go. Or if you've booked to have a file and paint, this will then be applied, so you can then proudly get those pinkies out on the show. So let's wrap up this guide by answering some of the most regularly asked questions. How long does it take? So to treat both feet, it takes only 20 to 25 minutes. So that's 10 to 15 minutes to apply the product, cling film and leave, and 5 to 10 minutes for the rest of the treatment, a little longer if you're having it painted. How often should I have a treatment? Again, that depends on your lifestyle and what type of shoes you wear, but we recommend treatment every 2 to 3 weeks, although results are seen after the first treatment. UK Callus Peel is a treatment, but sadly not a cure. Is it safe? Yes, UK Callus Peel Callus Remover is made with 99% natural ingredients. Is it hygienic? Again, yes, your beauty therapist is fully qualified and will know all the procedures for hygiene. The UK Callus Remover and Aftercare Cream are both dispensed from measured airless dispensers, which are hygienic. Now, the foot file scraper can be sterilised and the file replacement pads are replaced for each client. Does the treatment hurt? No, it doesn't hurt at all, and on the contrary, it feels like you're having a reflexology treatment. So it'll only hurt if you have cuts on your skin. Dry cracks are fine, as long as they are not weeping or bleeding. Is there any side effects? None, as UK Callus Peel is only for callous dry areas on the feet. Can I continue the treatment at home? Well, yes, to help maintain the condition and moisture to your skin, you can purchase the UK Callus Peel Aftercare Cream, which comes in a 50ml pump action bottle. Now, the Aftercare Cream is also formulated with no parabens and no urea. However, it is advised not to use when pregnant, as unlike the callus remover, it does contain a small element of essential oils. And just as a little bit of useless information for you, but did you know by the time you reach 50, you will have walked an average of 120,000 kilometres? Amazing. So that concludes the UK Callus Peel treatment guide here at East Park Beauty Studio. Please don't be afraid to get in touch if you still have any unanswered questions, the links to which will be available in the comments below. For all other videos on East Park Beauty Studio treatment guides, please like and subscribe to view. So thank you for taking the time to view this guide, and I hope to see you in person here at the studio soon.